This is Medicare Easy as Pie, brought to you by Mesa Benefits, your guide through the Medicare process, with Stephanie Garcia Hagen.
Thank you for joining us today on the Medicare Easy as Pie show. I'm your host, Stephanie Garcia Hagen. I'm the co-owner of Mesa Benefits, and we are your guide through the Medicare insurance process. I own Mesa Benefits with my husband and business partner, Bruce Hagen. Welcome to the show, Bruce.
Well, thanks.
Again. Can you believe it? It's one day from October.
That's true.
Here we go. It's going to be
From
fun.
October 1st till the end of the year, it's just a whirlwind.
It is just a whirlwind. Although Christmas is actually pretty nice because the enrollment period ends, or the election period ends on December 7th. So you kind of get a...
Yeah, we actually get 3 weeks there where there's just nothing.
Yeah,
I mean,
it's nice. Just a lot of follow-up and making sure you did your paperwork correctly.
That's true.
So it's not like we don't get to go to the office.
Oh, I'm sure that's true. Still got to go to work, right?
Exactly. So this week's pie is extremely relevant timing-wise. Beneficiaries have received their copies of this year's annual notice of change for their Medicare Advantage plan or standalone prescription drug plan. So let me make sure that the listeners understand what we mean. Whether you're on a Medicare Advantage plan or Original Medicare with a standalone prescription drug plan, you receive an annual notice of change from the insurance company. I had read somewhere, I think we talked about this a little bit last week too, but they called it an annual notice of coverage in something that I was reading. But I looked at somebody's actual report that they got in the mail, and it still says annual notice of change.
So we have two definitions with the same letters.
Yeah, I mean, it's definitely a change in your coverage, so I guess I could understand why it'd be called a coverage notice, but
Right.
you get it every year. The insurance companies are mandated to send those change notices to you, and they are definitely interesting this year. There's a lot more line items than there ever have been, I think, and it's definitely important to look them over. All right, so let me segue off here for a moment. There are a lot of rules. There's a lot of rules, right?
A lot of rules.
When it comes to Medicare insurance. All of the rules are intended to ensure the utmost safety for Medicare beneficiaries. Some of the ones that we as agents and brokers have to follow are cumbersome and leave way too much for interpretation. But the one that we're talking about today, in the annual notice of change documentation that you will receive from the insurance company, falls within these rules. Because your policy is an auto-renewing policy, you get to know what the changes are for the plan for the following year. The insurance company is obligated by law, mandate, statute, I don't know exactly, but they're required to give those changes to you on an annual basis. I'm sure it's a CMS regulation. It has to be, right?
It is.
Okay, so let's dig into the slices of the pie for today. Slice of the pie number one, what is an annual notice of change? We in the Medicare insurance world call it an ANOC. We have acronyms for everything.
There is an acronym for absolutely everything in this world.
So we're talking about ANOCs today, but for the show, we're going to call it an annual notice of change because those people that aren't in the industry don't need to probably learn all of our jargon.
Right, they wouldn't understand ANOC. They do now, though. You just told them.
I do like saying it, though.
Oh, yeah.
It's kind of a fun little word. Made-up word. All right, as I said before, the insurance companies are required by CMS to send you a notice of every line item change that happens in your plan. Did your premium go up or down? Did your copays change? Did your coverage change? Was a coverage added? Was a coverage eliminated? I do love the format of these notices, though, I will have to say. It literally takes every coverage and lays it out in two columns. The first is the coverage as it is through the remainder of the year, and the second is the coverage as it will be in the future. This format allows you to compare each item by itself. Let's move on to slice of the pie number two for today. Why do you need to even open the notice when it arrives in the mail? The answer to that question is twofold. It's funny because it's actually folded in half.
Yeah, good one.
Thanks.
Yeah.
The first is relative to standalone prescription drug plans. The main reason is that there are situations where the premium for standalone prescription drug plans that in some cases triple in price. I've seen people not open the annual notice and then quote unquote notice the change in July when there's nothing that we can do about it. Remember I've said in the past that your annual election period is the only time that you can change your prescription drug plan. The second is timing. Like I said, this is the time to make changes. The annual enrollment period starts on October 15th and ends on December 7th. This is the time frame that you have the option to make changes, and those changes can be for any reason. Is there a plan with a premium that offers the same coverage that has lower costs? Have you increased your medications? Have you decreased your medications? I've also seen situations where people made changes to the Medicare Advantage plan because the way to access dental services were easier on a different plan than the one they were currently on. Another common one is network consistency. We are very fortunate here in the Grand Valley. There are health systems in place that help to keep people covered and in network so that their costs are manageable. Like I said, the reason for the change can be anything. And remember, there's no medical component to Medicare Advantage or standalone prescription drug plans, only a time component. And the most common time frame for comparison is October 15th through December 7th, and it literally starts in 15 days. I guess it's 16 since today's the 30th, and probably really 17 because the 15th is on a Sunday. And you can call my office on Sunday, but I'm not going to be there, are you?
I'm not going to be there on Sunday.
No. So we don't work on Sundays. That was a rule we set up when we first started this business, and we decided to give ourselves Sundays off to be with family. And we always say we're going to go to church, but I don't want to get dressed up and go to church, so we just watch church on TV. But we're using that day as a down day to not do anything work related.
Just like Chick-fil-A.
That's right. We are Chick-fil-A.
Or Hobby Lobby.
Oh, Hobby Lobby's another one.
Yeah.
That's right. Exactly. We're just doing that. All right. Slice of the pie number 3. Is it important to go over the annual notice with your Medicare insurance advisor? Yes, yes, and yes. I believe that having a local trusted advisor in your Medicare insurance advisor is paramount to keeping all of the slices of Medicare pie straight. Bruce and I have experience with options available to you if you are dissatisfied with the changes to your plan. We can have an in-depth conversation about what the changes mean and how they affect the next year of your coverage. As a matter of fact, this is a requirement for us to remain compliant in our profession. We take the responsibility of advising you of your options very seriously. I think now's a good time to tell you how to get in touch with us. We can be reached at 970-549-0410 or on the web at mesabenefits.com. All right, final slice today, number 4. What if I don't remember who my agent is? We get this one a lot too.
Well, and you should know who your agent is if
Right,
you
but
have one.
sometimes they move.
Oh, that's true. Or they're not in the business anymore.
Right, or you're one of those people that didn't open your
Or you don't have an agent.
Right, or you didn't open your annual notice of change until July, and now you're thinking, okay, maybe I should get in touch with an agent.
Yeah, or you enrolled over the phone and you don't have an agent.
There you go. So obviously, Bruce and I are Medicare insurance agents. We want you to have all of the information available to you so that you can make the best decision for you, your lifestyle, and your budget. I call, email, and send letters to all of our clients to let them know that we're available to go over these annual notices of change. If you did not get that opportunity from your agent or you don't remember who they are, Mesa Benefits is happy to do it for you. We will go over your notice and see if you want to make any changes. This comprehensive review is complimentary to you, and we believe it is our obligation to educate and guide beneficiaries through the Medicare insurance process. That process did not stop when you enrolled in your plan. It is ongoing, and we are here for you every step of the way. Please call the office at 970-549-0410 to make an appointment with Bruce or me. The annual notice of change is super important. I can't iterate a word?
Reiterate.
I can't reiterate this enough. It details what's happening with your plan for the upcoming calendar year. Remember, your plan is good from January 1 to December 31. We want to encourage you to read it, review it, and if you don't feel comfortable doing it on your own, we can help. This year's annual notice of change meetings have a special component to them. There are changes with the existing plans in the area that are going to make the lives of Medicare beneficiaries that much better. Benefits have become richer, and I think you're going to like what you see. Some of the plans that have always been what Bruce and I like to say steady Eddie are going to remain just that, steady. But the exciting news is that we have a new carrier entering the market. Bruce and I are thrilled that there are going to be even more options on the Medicare Advantage side of the business for beneficiaries. I think we should wrap it up for today. If you need help with your Medicare insurance, please give us a call, 970-549-0410. This is the Medicare Easy as Pie Show. Join us back here next week for more slices of the Medicare pie.
Thanks for listening. This has been Medicare Easy as Pie with your guide through the Medicare process from Mesa Benefits here on 1100 KNZZ.